We've got our heaviest loop band around our thighs. We're going to come to lie supine for bridging. Our feet are hip distance apart and perfectly parallel. Make sure the feet aren't turning in or out. Press into the baby toes to activate the lateral intrinsic muscles of the feet. Find a neutral pelvis if you have back issues, or pelvic flexion if you don't. Pressing into your triceps, forearms, and hands, pick the pelvis up into the air, fogging a mirror as you exhale. Hold it here. Inhale 1, breathe. Exhale 1. Inhale 2, brace the abs. Exhale, melting the chest back towards the shoulder blades, imprinting shoulder blades, back ribs, and then tailbone. Reinitiating awareness of the pelvic position, flexion, tucked if you don't have back issues, neutral if you do. Push into the baby toes. Brace the abs. Exhale, send the hips up. Inhale 1, breathe. Exhale 1. Inhale 2, brace the abs, reaching the chest towards the shoulder blades, imprint them, then the back ribs, then the tailbone. So slide one hand under your low back. Make sure that's all you can fit under there if you have back issues. Neutral pelvis, belly pulled in towards the spine. If you don't have back issues, tuck your pelvis and make sure you can't slide any hand underneath. You've completely flattened the low back into the floor before you lift the hips up. Hold the hips up. Inhale 1, breathe. Exhale 1. Inhale 2, exhale 2, lowering down on that exhale. Pausing at the bottom to check your pelvic position. Inhale, prepare. Brace the abs. Exhale to send those hips up into the air. Holding them up. Inhale 1, breathe. Exhale 1. Inhale, reach the chest towards the back body, imprint the shoulder blades, back ribs, and tailbone. Check your pelvic position. Inhale, press into the baby toes, send the hips up. Make sure you're pulling out on the band, hip distance. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale to lower. 2, 3. We'll take our foam roller, place our feet on it. The farther away from the body the foam roller is, the harder this exercise is. Wrap your feet around the roller, still hip distance apart, but trying to make contact with the heel, arch, and metatarsals. Brace the abs, finding the pelvic position that's proper for you, neutral if you have back issues, flexion if you don't. Lift the hips up. Hold them up. Inhale 1, breathe. Exhale, lowering slow. 2, 3. Inhale, prepare, brace the abs. Exhale, lift those hips up. Hold them up. Inhale. And exhale to lower. 2, 3. So now you know what we're doing. I'm going to give you some cues as you continue with this tempo. Inhaling at the bottom and top, exhaling to lower and lift. As you're working, watch out for just the heels or just the insides of the feet working. Make sure the baby toes are wrapped around and you're trying to grab the roller with all edges of the feet, like a bird would wrap its claws around a tree branch. That's what you're trying to do to the roller with your feet. Watch out for the knees knocking in. Keep them hip distance apart, pulling out on that heavy Theraband. As you send those hips up, make sure the belly isn't pressing out. Pull it in towards the spine and lift up on those muscles that stop your stream of pee. You should hear your exhales, fogging a mirror or Darth Vader. Reach that chest towards the back body as you puddle the heart inward. Think ice cream on the chest as you lower back down, imprinting each vertebra into the floor. Finish up your last one, and we'll set that roller to the side, bringing our feet back onto the floor for some floor bridging with marching. We still have our heaviest loop band around our outer thighs, and our feet are hip distance apart, perfectly parallel. If you need to do a little crunch up, keep your neutral pelvis to do that. Check the feet out, and then set up. Slide your hand under your low back to find out if you're in a neutral pelvis, or tuck the pelvis under, flattening the low back if you have no back issues. Brace the abs, press into the baby toes to send the hips up into the air. Inhale. Exhale, extend your non-dominant shin out. And inhale, lower it down. Brace the abs. Exhale, extend your dominant shin. And inhale, lower it down, peeling down, melting the chest towards the back body, imprinting vertebra by vertebra back into the floor. Inhale, prepare, brace the abs. Neutral pelvis if you have back issues. Pelvic flexion if you don't. Press into the baby toe, send the hips up. Inhale, exhale, extend your non-dominant shin. Inhale, lower it. Brace the abs. Exhale, extend your dominant shin. Inhale, lower it. Inhale and exhale, reach the chest towards the shoulder blades, imprint them, back ribs and tailbone. You're doing great. So let's continue with this tempo. I want to remind you of some checkpoints as you're working. Really think about your feet. Use those baby metatarsals. Keep the legs hip distance apart, pulling out on the band with those outer thighs, the abductors of the legs. Watch out for belly pushing out. Pull it in towards the spine deeply and tug up on those muscles that stop your stream of pee. Each exhale, you should hear and you should be working internally. It's that lift up on those muscles that stops your stream of pee that will help contract the transverse abdominis. Keep your shoulders down the back, collarbone wide, chest reaching for the shoulder blades, chin retracted to engage the neck flexors. Finish up your last one here. And now we're going to bring our feet back onto the roller. And we're going to take subtle external rotation with the feet still just a little wider than hip distance apart. Trying to still get all edges of the feet on the roller wrapped around. We're going to be doing some hamstring curls here. So I'd like you to watch this first. You'll inhale, prepare, brace the abs, send the hips up. You'll exhale as you roll out over the Achilles, back in, taking the heel, arch of the foot, and metatarsals onto the roller. Then we'll peel back down slowly to the floor, checking in with our pelvic position, wrapping the feet completely around the roller. Inhale, prepare, lifting up, and we go out, in, rolling over the Achilles, back to the heel, arch of the foot, and metatarsals, and lowering down. Let's go ahead and begin working on that hamstring strength, remembering I have subtle external rotation to get the lateral hamstrings, the outsides of the hamstrings engaged. So I'm not perfectly parallel here, but I'm not over rotating to bother the knees or ankles. So you're moving on your breath here. Just make sure you're really thinking about what area is attached to the roller and keeping your hips even and high. Use the exhales to shoot the legs out and in. You can go at a nice slow tempo, going over the Achilles, then pulling back in, over the heel, arch of the foot, and metatarsals. Inhale, prepare, brace the abs, and exhale. Hear those exhales. Use the baby toes as much as the arch of the foot and the heels. Try to get all metatarsals connected to the roller as you lift up into that bridge, and try to not have the bridge moving in and out. Just press straight up, and then you go out in with a roller for your hamstring curl. Be mindful of your chin. Keep it retracted. Shoulders plug down the back. Collarbone wide. Sternum reaching towards the back body. Those feet are really working efficiently here. This is going to help retrain the muscles of the feet so that you start to rebalance the legs and decrease back pain as a result. So as you're breathing here, I'd like you to finish up your last curl. And we're going to extend the legs out on the roller, flexing the toes to allow those hamstrings to release. Go ahead and circle your right foot out for 10, 9, 8, 7, 6, 5. You're dorsiflexing the other foot as you're doing this. 4, 3, 2, 1. Now the other side. Circle that foot out for 10, 9, 8, 7, 6, 5, 4. Make sure you're circling away from the body and the other foot is still and dorsiflexed. Finish up with that. You can scoot the roller out of the way, rolling to one side to come up to a seated position. Great work.